Acoustic neuroma. An acoustic neuroma is a slow growing benign tumor of cranial nerve 8th, usually arising from Schwann cells of the vestibular portion of the nerve. Schwann cells SCHWANN, Schwann cells. Most acoustic tumors arise within the internal auditory canal and extend into the cerebellopontine angle to press the brainstem. Acoustic neuromas account for 5% to 10% of all intracranial tumors and seem to occur with equal frequency in men and women at any age. Although most occur during middle age, most acoustic neuromas are unilateral except in von Recklinghausen disease, that is neurofibromatosis type 2, in which bilateral tumors occur. Von Recklinghausen's disease, VON, von Recklinghausen, RECKLINGHAUSENS, von Recklinghausen's disease, that is neurofibromatosis type 2, in which bilateral tumors occur. Assessment and diagnostic findings. The most common findings of assessment of patients with an acoustic neuroma are unilateral tinnitus and hearing loss with or without vertigo or balance disturbance. It is important to identify asymmetry in audiovestibular rest results, so further workup can be performed to rule out an acoustic neuroma. MRI with paramagnetic contrast agent, that is gadolinium or magnivist, is the imaging study of choice. If the patient is claustrophobic or cannot tolerate an MRI, or if the scan is unavailable, a computer tomography CT scan with contrast dye is performed. However, MRI is more sensitive in delineating a small tumor than in CT. Management. Surgical removal of acoustic tumors is the treatment of choice because these tumors do not respond well to irradiation or chemotherapy. Because treatment of acoustic tumors crosses several specialties, the multidisciplinary treatment approach involves a neurologist and neurosurgeon. The objective of the surgery is to remove the tumor while preserving facial nerve function. Most acoustic tumors have damaged the cochlear portion of cranial nerve 8th and no serviceable hearing exists before surgery. In these patients, the surgery is performed using a translabyrinthine approach and the hearing mechanism is destroyed. If hearing is still good before surgery, a suboccipital or middle cranial fossa approach to remove the tumor may be used. And intraoperative monitoring of cranial nerve 8th is performed to save the hearing. Complications of surgery for acoustic neuroma include facial nerve paralysis, cerebrospinal fluid leak, meningitis, and cerebral edema. Death from acoustic neuroma surgery is rare. Thank you.